Yeah, it's a privilege for me to speak regarding homeopathy on a homeopathic college. All other speakers were talking on hybrid subjects, so it's a happy thing. Whenever coming to this old pristine college, that moment itself gives goosebumps because what homeopathy has achieved across the state of Kerala has its origin, had its beacon in Calicut, rather Kozhikode Homeopathic Medical College, which had made generations of homeopaths and old veteran homeopaths. Thank you. ഇതാണോ നീ? So coming to directly our topic, chronic cancer pain. I represent a cancer institution, rather a palliative institution. So I am speaking specifically on cancer pain, which amounts of 20% of total chronic pain, which can persist, or rather it makes dysfunctional or affect the quality of life. And this is the graphical plotting. Always, rather we speak about chronic pain making disability. The thing is, that contributes to a lesser amount. The whole thing comes from a pathological aspect. The remaining, a lesser part affects the quality of life. This is the classification. So how homeopathy can make some add-on treatment, rather adjuvant treatment in mitigating cancerous diathesis, rather pain or its allied symptoms. There can be three types of pain episodes. One is acute pain, which is coming simply as an isolated acute episode. Rather, a chronic pain in established malignancies. An acute on chronic state is usually seen in our IP, inpatient centers, because that will occur as an episodic illness only, and which is very difficult to manage. Apart from primary malignancies, metastatic cancers can be a real challenge where pain makes the physician more disturbing rather than the patient. And there is a terminology called chronic pain syndrome, which usually sounds similar with pain, but the difference is chronic pain syndrome is psychological, while chronic pain is purely physical pain, or rather mental pain. So how can homeopathy makes an intervention? Whenever we speak of homeopathic mode of treatment, it's better that students or postgraduates or aspiring researchers should use a methodology or mode of intervention, because we generally belong to CAM therapies, rather complementary and alternative medicine therapies. So homeopathic intervention is the better terminology. How can we make use of, rather apart from the hegemony of conventional medicine, rather the scientific dogmaticity is you always being challenged regarding homeopathy. How can a homeopath make an entry point to a multi-trillion-dollar business of oncology? And this slide will help you to make an understanding. We can use it as an add-on therapy, that is synergy. Synergy means coexistence. That will be the better thing for us to survive in a hybrid environment. It can be used as an add-on therapy. Adjuvant therapy means after a definitive treatment, homeopathy can be used, which makes harmony. It can be used as a monotherapy or a standalone therapy in some cases, especially in stage 4 lung cancers with unidentified mutations. If mutations are there, definitely gefitinib, asafotinib, osimertinib, any medicines can be tried. But in stage 4 lung cancers, which is my topic for my PhD study, homeopathy can be a beacon of hope. There, homeopathy can be used as monotherapy. Also in established hepatocellular cancer, where patient is having a pre-morbid illness of chronic liver disease, rather child A, B, C or category, where the liver function is optimum, below optimal level, homeopathy can be used. So the last is palliative homeopathic approach, which is the best wisdom. This is my personal perception regarding homeopathic therapy. Rather, homeopathy can be betterly termed as it's an immune modulated, targeted oral drug therapy. Complying with the definitions of W.E. Boyd, we can redefine, or we can, every time students, postgraduates, researchers, aspiring homeopaths should try to make redefinition, rather redefining, or rather making a paradigm shift of concept, envisaging and execution, because our system has so much potentialities to use, but unless and until good type of inquisitive research, rather in-depth studies of our materia medica makes our science a good help tool in the field of oncology. So 30% of cases we can use homeopathy as palliative, where widespread cases, aged cases, relapsed malignancy, monotherapy, as I told, stage 4 lung cancer, hepatobiliary pancreatic malignancy, relapsed fluid malignancy. Fluid malignancy means hematological malignancies. As an adjuvant or add-on therapy in after second or third line of chemotherapy, blood malignancies. So this is a case of beta AL, BALL relapse after chemotherapy. This case was a female aged 36 years with CNS infiltration. Seeing her age, it is very unfortunate. Our observation period was 15 days in our inpatient center. Really a challenging case. The patient presented with neutropenia with 75% of blast. The scheduled chemotherapy was taken, but unfortunately, she got a CNS infiltrate, resulting in facial palsy, total fatigue, severe pain. During our 15 days management, the blast cells were reduced to 50% with platelets. We had given supplementation by IV fluids, platelets and PRBC, packed red blood cells. This was the medicine which made her alleviated. Acetic acid 30, as you know, acetic acid 30 can be used after any treatment, especially presenting symptoms of surgical shock, rather hypovolemia. Patient present with symptoms of shock. Acetic acid followed by natriuretic LM potency. LM potency is the best potency which you can try in oncological cases. It can be repeated frequently and that won't make any unwanted aggravation, and that can be changed. The medicine can be changed without any further waiting, because we can delineate, rather we can denominate the sphere of action, rather the period of action. This was the medicine, and after 17 days the patient succumbed, but we could offer her a peaceful and a respectful, meaningful life. It's a case of CA breast. Here homeopathy was used as a monotherapy, aged patient, multiple comorbidities prevented, rather made the patient deferring conventional methodology of treatment. As you can see, HER2 was positive. Every breast cancer cases will be undergoing immunohistochemistry classification or categorization. HER2 means trastuzumab injection is the medicine of choice, but because of the multiple comorbidities, trastuzumab was not taken, and our prescription was on graphitis in LM potency, followed by coniamac, and during episodes of pain, Asieris rubens was tried. Observation period was 9 months. So how can we evaluate? As you all know, there is a widespread book, The Emperor of All Maladies by Siddhartha Mukherjee, a cancer doctor from US, actually he is from India. He has made a comment regarding Ayush systems when he was asked about the impactness of Ayush system. He made the great statement, because the evaluation matrices should be the same. We can't say to a hybrid community, rather to a conventional medicine doctor, that we gave this medicine, the patient was okay. So the matrices, rather the evaluation matrix should be like this: prognosis assessment, the shape, and it should be objective. We can't record that patient said, I felt better after a medicine. No, the assessment shall be purely objective and it should have fixed protocols. So in my center, rather in our center, we are trying to deduce protocols and make fixed guidelines for each and every malignancy so that it can be translated, rather it can be transgressed to other communities of medicine, or rather interconnectedness of physicians in general. So we need to analyze, we have to assess using questionnaire. Our aim is extended progression-free survival, and we need cytoreduction, and we should judge the modified clinical outcome. What homeopathy can offer in oncology is better termed as the clinical outcome will be betterly modified. This is a case of multiple myeloma where the patient is continuing chemotherapy. As we know, multiple myeloma needs continuous maintenance chemotherapy. Injection board is also, many medicines are there. Here homeopathy was used as an add-on mode. You can see the blood picture, electrophoresis, monoclonal antibody, M-band, M-spike was there. The medicinal management, we managed 26 months, means almost 2 years. So how can we summarize? Physiological optimization, that should be the dictum of every homeopath, rather every physician attending an oncological patient and attending a patient like this. We have to optimize the physiology. We have to check the blood counts, address these things. We receive patients after post-chemotherapy with extreme fatigue, cancer-related fatigue, CRF. It's a very deadly thing to manage. Our medicines, alfalfa and avena sativa, gives good results. Post-radiation effects, and for mucus after stomatitis, which is a deadly thing which makes patient unable to even to take a drop of water, acid muriaticum and CKL core is a good medicine we have experienced from our center. So these are the post-radiation effect, these are the post-surgical effect where acetic acid and strontium carb will be the good medicine. And the total the disease, we should aim at fever, controlling fever, pain, infection, sepsis, rather a multi-organ failure. Again, these are the two challenges which are getting every time undermined in metastatic cancers. This is an example. This is not an fictitious, imaginative example. It's a real case story. A case of CA breast. She did lumpectomy. The oncosurgeon advised her lumpectomy, not going for any following by chemoradiation, and because of HER2 positivity, she received trastuzumab. Well, as you know, trastuzumab injection cost more than 1 lakh, and patient needs more than 17 injections. So you could imagine the economic burden. And within 2 years, she ended with multiple metastases. That is the real challenge. That is the real depth or gravity of this oncological metastatic. And again, another case of CA ovary, where the patient underwent a surgical resection, neoadjuvant chemotherapy, and resulted in peritoneal carcinomatosis, which is a disseminating cancer because it has spread to omentum, peritoneum, ending in devastating results. So this is a case of periampullary cancer of pancreas. Here homeopathy was employed as a monotherapy because of history of cardiac illness. Female age, we observed for 36 months. See, those who know that the prognosis of pancreatic cancer is very bad and very challenging, very unfortunate. So getting a period of 36 months is very promising. Her lipase value was like this, and after treatment, CA19 point value dropped down from 382 to 40. Plumbament was the medicine, and during pain episodes, calcarea ars and diascorea was used. These cases are under review under various journals for case reports. We are waiting for its publication. So another case of metastatic CA ectosigmoid case. As you know, homeopathy was here used as an adjuvant methodology. Adjuvant means after definitive treatment, post-CT, post-chemotherapy, colostomy reversal was done. See the plight of the patient. See the plight of the whole family. They have undergone surgery. They have undergone colostomy. You can even imagine the difficulties a patient experiencing during colostomy bag, daily routine checkup. And colostomy reversal was done, but severe pain was continuing. How that this patient reported to our center within 15 days. You can see the multiple metastases. Liver, lung, main centers have been checked. Acid nitricum in LM potency, and with aloes we could make Sulex. So CS stomach, again monotherapy mode, nodal meds, 60 days observation, which means 5 years we could manage. So what are the outcomes? What are the outcomes we can expect? Extended longevity, better quality of life. We could control the intervening infections, lymph node reduction, cytoreduction, overall survival optimization. So homeopathic angle is like this. We can use constitutional prescription, specifics, pathological, physiological, and randomizing prescription. That is the dictum. When no active lesion is present, you can use active aggressive pathology. These type of angles we can use. This is the WHO ladder for pain pattern. Step 1, step 2, step 3. I'm not going into the details. Just with this, we made a algorithm. This is the algorithm. Step 1 is with trying specifics, aconite, belladonna, chamomile, and euphorbinum. Step 2 means deeper medicine plus specific, where mineral or metal will be tried. Mineral kingdom, calcareous, carbo, or animal kingdom apart from vegetable. As you can see, first our line of starts with vegetable kingdom, then slowly escalate into animal, material, mineral, metal, and then absolutely of no sorts and circuits. So step 3, deeper plus specific physiological dose you can try, and step 4, even with conventional pendanile patches, even patients screams with pain, we can try no sorts with better results, and usually syphilinum is the drug of choice. So homeopathy can be used as helping tool. These are esophagus case, CA bladder, CLM, multifocal HCC, and beta ALL post chemotherapy. So addressing specific lines, 55% of patients report with pain control or infection control, 10% with nutritional, 35% of symptomatic control. This graphical plot is an analysis of our cases, whole cases of our center till date. So pain, an algorithm for pain in general, you can use ABC, epismel in 3x, starting from 3C or 3x, belladonna 3x or 3C, and calcareous. C means calcareous carbon chamomilla. This is pain regarding gland. For breast cancer, you try add-on therapy. Advanced cancer, buforana. Fungating cancer, Hoangnan. Palliative, carboanimalis. Glandular cancers, ovarian cancer. Inoperable stomach cancer. Region-wise, an algorithm. This is a detailed slide because of time constraints. Those who wish to have, I can share. This is a metastatic cancer. Our approach, we use constitutional medicine and LM potency with functional aiming of functional, pathological, and treatment burden, where no sorts play a bigger role. So these are the multiple lines. So after patient reporting with multiple lines of chemotherapy, we could have the suggestions for BRCA1, BRCA2, active malignancies. TNBC means triple negative breast cancer, which is a great challenge for breast cancer physicians, where the medicines, chemotherapy medicines found less effective. So this is a breast data analysis. We did total number 410 cases registered, out of which patient continuing treatment and patient making other case. It's a case of 73-year-old female. The case analysis. Actually, there's a photograph. The big ulcer. It was the patient. You can imagine the pain. And during treatment, this was the last figure. We were successfully able to heal the wound. You can see it was Berat's 5. This is another thing for reducing tumor marker. We did, our aim was to reduce tumor marker, so it dropped down from 124 to 11.7 in a case of ovarian cancer. So this is our center. We have state-of-the-art technologies, Fowler's bed, including all inpatient facilities. What a oncological patient, rather a palliative patient demands. We have trained the successful staff, almost all allied facilities. So those who wish to have a visit our center is always welcome. So it's very clear. It's a word of gratitude. Illness as a metaphor. This is a quoting from Susan Sontag, American writer. So she makes an analogy of illness as a metaphor in her famous book. Thank you.